following segment of Daytime Buffalo is sponsored by Eldercare Solutions. If you or someone you love needs auditory aid, Phil is here with a local company that can help change the way you hear. Phil, who have you brought with you today?
I brought Dr. Ashley Grant. She's from Buffalo Hearing and Speech. And she's going to really tell us how audiology has changed. And did you know that if you can't hear, it could aid in dementia?
I did not.
Yep. And could it be maybe people thinking that you have dementia?
Ah, there you go. Okay, this is why hearing is important. So Ashley, first talk to us about hearing and maybe things that people don't understand about the mechanics that most people have.
So for years, the audiology industry thought about hearing as just the ear. We fit a hearing aid and we sent you on your way. But in the last 10 years or so, there's been a big shift to thinking about hearing health as brain health. And so if you have cognitive deficit, your hearing can really make that worse. It can accentuate it. It's not going to cause dementia or Alzheimer's or anything like that, but it could definitely make it worse and your symptoms worse.
Right, that makes sense. Okay, so let's talk about the process of changing the directions of audiology.
So about 10 years ago, studies started coming out. There were 4 of them that were significant, showing that your cognition and hearing were linked. And so one of the studies showed that if you have dementia or Alzheimer's as a diagnosis, if you treat with a hearing aid, if you have hearing loss, it will decrease your symptoms. Okay. One of the other studies showed something called cognitive load. If you can't hear, there's an extra load on your brain just trying to figure out what it is that you heard, and then you don't have room to remember it, act upon it, store it.
That makes sense.
Yeah, and so that's really been the big change in the industry for audiology.
Okay, because I was always under the impression that hearing is one of those things where if you start to lose it, you can't get it back. Is that still the case, or is that still thought of?
So a hearing aid doesn't bring your hearing back, but it allows you to hear as close to a normal level as possible when the hearing aid is fit appropriately. But if you have cognitive deficit, memory weakness, executive function weakness, processing speed that's a little bit slower than average, you're still going to struggle even with a hearing aid.
Okay, so let's talk about the cognitive screener that you use in your hearing evaluations and how that helps you create those treatment plans.
So we've now incorporated a CogniView cognitive screener. It's a 10-minute computer-based cognitive screener, and it looks at the 5 areas of memory, executive function, processing speed, reaction time, and we utilize those because if one of those is grossly delayed or outside of the normal screening limits, then we would know that you would have a little bit of extra difficulty hearing, even with an appropriately fit hearing aid.
Okay, that makes sense.
Yeah.
And in-house, you do have some experts cognitively, right?
Yeah, so we have a couple speech-language pathologists who specialize in cognitive rehabilitation, and their job is to work with people who have had a stroke, or been diagnosed with dementia, or Alzheimer's, or even just mild cognitive impairment, and they can work with them on strategies so that they can function better in their daily lives.
And that's communication, that's speaking, and...
It's speaking, but it's also strategies to remember what it is that they have to do that day. And so a lot of times this diagnosis comes down and people are just like, well, now what do I do?
Right.
And so there is an answer, and these cognitive rehabilitation specialists are so, so important.
Yes, so when you are struggling, it's not like this is over, you're just going to be sitting there not being able to communicate or be communicated to. There are things that you can put in place to help your loved ones to live still, which is what this is all about, Phil.
Correct.
Keep that independent, full life.
Exactly.
I mean, that's what separates Buffalo Hearing and Speech from other providers in the area, is that we have cognitive rehab specialists right on staff, and we're working together to treatment plan the patient.
And how many locations are there?
There's 4 office locations.
Oh, wow.
Okay, Phil, why did you want to highlight this today?
Well, just because, I mean, Alzheimer's, dementia, you hear so much of it today. And it's like, why don't you make sure that your hearing is in check? Make sure that you have all the tools and everything working functionally to make your best life. And if you didn't get your hearing checked, maybe it's time that you do.
That's right. And
Definitely.
Dr. Ashley, how can our viewers find a provider who's going to have this holistic approach to hearing healthcare?
I think a lot of people don't understand that there's hearing dispensers, hearing aid dispensers, and then there's audiologists as well. And an audiologist has a 4-year doctoral degree, and so we look at things from a very medical standpoint. And so just asking your provider some questions. What's your degree? What do you think about cognitive rehabilitation and hearing aids and hearing loss? And how do you feel about what's my treatment plan going to look like? Make sure you feel comfortable with your provider.
Okay.
And Ashley, is it covered with insurance? Do most insurances cover hearing tests?
Ooh, the insurances cover hearing tests for sure, but most of them only have discount programs for the hearing aids themselves.
Okay. Yeah.
Okay.
Just make sure that you get your hearing checked.
Absolutely. Well, thank you so much
Very
for
welcome.
coming in.
Thank you
and
for
sharing
having me.
more. Of course, viewers, if you would like to learn more about their holistic approach to hearing healthcare, just visit askbhsc.org. This Purposeful Living segment is sponsored by Eldercare Solutions. Thanks again for coming in.